Hi, Dr. Anwesha. Sorry for the glitch. I am unable to find your username. How are you?
Okay. Yeah, I'm fine. How are you?
I'm fine too. So, welcome to Ayurveda. As you know, that we are here to discuss about PCOD today. And let me introduce you to the people present here. She is Dr. Anwesha, and today we are here to discuss PCOD. That is very common nowadays. So,
Yeah.
let's start. Okay. Are you comfortable with my language or I should start
Absolutely.
in? Okay.
Absolutely.
So I want to know what is PCOD. Let's start with the basics. What is PCOD?
Yeah. Nowadays, I think I don't need to say what is PCOD because each and everyone
Exactly.
knows what is PCOD.
Yeah.
Means even the non-medicals, whatever in field they are in, everyone knows what is PCOD or PCOS, whatever.
Yes.
They know
Can you please
that.
share a little difference? What is PCOD and what is PCOS for the people who don't know?
Yeah, I am
Yeah.
coming in that topic.
Yeah. Yeah.
So, um, PCOD is polycystic ovarian disorder that
Okay.
is happening because of the hormonal imbalance in our body, which can
Okay.
happen in our body anytime. Anytime it can happen. Like
Yes.
and in any age group also means up to 50 when we are not means up to the menopause time we can means from the mena to menopause in between this time we can have PCOD, and nowadays it's very common because of a
Yes.
lifestyle.
Yes.
So coming to your next question, that is PCOD and PCOS,
Yes.
both are just the same thing, just same thing.
तो
PCOD is the
मतलब
old term, PCOS is the new term what we doctors are using it.
अच्छा
Just
दोनों
there is
सेम है.
same ही है. PCOD is like polycystic ovarian disease, and it is polycystic ovarian syndrome. Nothing
Okay.
is different in it. Just a disease and it's a syndrome. It's nothing. Both the symptoms are same. Everything is same. Just the term wise, it's a old term. Is the new term.
ओके.
Nothing
तो
is
हमें
different.
कैसे पता लगता है कि हमें पीसीओडी है या फिर पीसीओएस है?
Hmm.
मतलब इसके
Very,
सिम्टम्स क्या-क्या
very
होते हैं? हमें कैसे आइडेंटिफाई करेंगे?
Hmm. Very interesting question. And this question I get every time whenever I'm diagnosing a case of any gynecological case I'm diagnosing, I'm getting this question from each and every patient. That
Yes.
how will I understand I'm having PCOD or PCOS? Means PCOD. I saw many patient in my means in this short treatment journey that
Exactly.
um, there are many patients who is not even telling the symptoms of PCOD, like irregular menstruation, your facial hair, or whatever the symptoms of PCOD means of PCOD there are, like mood swings. Irregular menstruation is the main symptom of PCOD, but that symptom is also not showing to a patient whom I diagnosed PCOD. Means a patient who is
मतलब ऐसा हो सकता है कि ये सिम्टम्स ना दिखें फिर भी हमें पीसीओडी हो सकता है.
yeah, whenever I'm asking, means I am just just guess that there is some problem in them. Means I'm telling a patient came to me with a problem of dry skin. Okay.
ओके.
So I asked normally that why means from when, how long, how far means how long you're having all this problem. So I just guess that maybe there are some problems of having some hormonal disorder because she told me a history of mood swing, only one mood swing. That's only a symptom she told, but nothing more she told. So I went for USG, and in USG there was PCOD was diagnosed, but she wasn't having a menstrual irregularity. That's the thing.
ओके.
Means one,
मतलब सिर्फ मूड स्विंग्स से आपने आइडेंटिफाई कर लिया कि उसको पीसीओडी या पीसीओएस हो सकता है.
just a
हाँ
thing is
मतलब.
I was like okay, let's see if there are anything like because wait, whatever patient are coming in our clinic, with gynecological problem, half of them are having, I mean, shown that can be diagnosed with PCOD. Half of them. Even means I have to go blindly, like means I have to hold, I have means that's the thing is I have to just think from beforehand that she must be having some problem. She must whatever some problem she will be like in PCOD we are having problems like in diabetes also we get
Okay.
many hormonal irregularity also we get in PCOD. In hormonal irregularity we are having one of the main thing we're having that is thyroid problem.
Yes.
Either the patient is getting hyperthyroidism or hypothyroidism, and dry skin can be a reason for hypothyroidism.
Okay.
So that's the thing is, and the patient was also diagnosed with hypothyroidism, that patient. That's
Okay.
the thing is, just a means everything is just tied in a single
Related.
string.
या
That's
ओके सो अगर हम काउंट करना चाहें तो इरेगुलर मेंसेस हो सकता है, ड्राइनेस हो सकती है, हार्मोनल इम्बैलेंस हो सकता है, मूड स्विंग्स हो सकते हैं। ये सारे पीसीओडी अगर किसी को जानना है कि हमें है कि नहीं तो वो अपने आप को ऑब्जर्व करे और फिर पता लगा सकता है, या फिर
just
गायनेक तो
visit
है
a
ही।
doctor for any problem. For visit a doctor,
या
doctor
एग्जैक्टली।
means it's up to the doctor. Doctor will understand what you are going through and not going through. It's just you don't have
या
to think
दैट्स द
anything.
फैक्ट, दैट्स द फैक्ट। तो इनका बेसिकली रीजन क्या होता है? जैसे आपने बोला है कि हमारी लाइफस्टाइल बहुत अफेक्ट करती है, तो इन किन तरीकों से मतलब क्या खाना पीना अफेक्ट कर रहा है या हमारी स्लीप साइकिल अफेक्ट कर रही है? मतलब कहाँ पे क्या रीजन होता है इसका मेनली होने के लिए? मतलब पीसीओडी होता क्यों है?
Nowadays, the first thing that is starting from the morning, waking up late,
यस, वो तो
and then
फेवरेट
after
है।
that, then after that, having a very heavy breakfast, which in Ayurveda is told to be having a light breakfast. But we are going for a very heavy breakfast, paratha. Khali pet,
यस।
we are having a paratha. That's the main thing. Means your digestion system is all that in the morning. Our digestion system is not even means ready to digest a whole paratha. But we are
या
having a
ओके।
paratha then. And you also know that in everyone in Ayurveda fraternity knows that the disease arises from the gut. All
ओके।
the thing is in the gut. So if you are having a good good digestive system, so we can have a very healthy lifestyle. But we
ओके।
are just rising, means waking up from the sleep and having a paratha is just hampering our digestion system. And after that
ओके।
also,
तो
yeah,
मैंने ऐसा सुना है कि मतलब कुछ लोग कहते हैं कि ब्रेकफास्ट बहुत इंपॉर्टेंट होता है, ब्रेकफास्ट स्किप नहीं करना चाहिए, और कुछ कुछ
that
लोग
is
मॉर्निंग में फास्टिंग करना प्रेफर करते हैं, वो डायरेक्ट लंच खाते हैं। तो मतलब इन दोनों में से क्या सही है? ब्रेकफास्ट नेसेसरी मतलब बहुत नेसेसरी होता है, उससे आपका पूरा दिन बनता है, या फिर मतलब यू कैन स्किप ब्रेकफास्ट? मतलब दोनों में से क्या सही है?
no, that is a Western means thinking that having a heavy breakfast is a Western thinking. In Ayurveda, it is told to have a very light breakfast, heavy lunch, and light dinner. Means the graph goes from down, up, and down. The graph goes.
ओके, मतलब
Means
ब्रेकफास्ट इज नेसेसरी।
breakfast is means just don't skip the breakfast because staying up so means staying hungry for so much time, it's absolutely hampering your digestion system. But if
ओके।
your agni is not even ready for that time, it's early in the morning, our agni is not even ready for digestion for digesting a whole paratha. And it is
ओके।
also told in Ayurveda that our digestion system, means humans' digestion system, is directly linked with the sun. As the sun rises up in the head during the afternoon time, our digestion system is also at the peak during that time.
ओके।
Because that time
ओके,
the
दिस इज
pitta is
इंटरेस्टिंग।
high. The
या
pitta
ओके।
is
ओके।
high. So in the morning
ओके।
time, there is no pitta is high that time. That is cough time. So you must have
ओके।
a very light breakfast that time.
ओके।
That's the way is hampering all the thing. and all the diseases are forming in that way. That's the thing.
Okay, so
And
that is
after
the
that
first
also,
reason for having PCOS. That is the first reason for
even
PCOS.
after that also, even in the lunch, there are many people, like you told, that many are having a heavy breakfast and skipping the lunch. That is not good.
Yeah.
And directly having a dinner, there's a lot of gap between that time. And there are some people also, after having lunch, they're going for a nap, afternoon nap.
Yes.
And we all know that afternoon nap, Divasavana, is contraindicated in Ayurveda because it increases cough in our body. And PCOD is a cough-related disease. So it
ओके
must not
बट
be
इंडिया में
a
तो यही होता है ना कि खा के सो जाओ क्योंकि खाने के बाद तो
exact.
आराम चाहिए
Exactly,
yes yes
exactly,
yes
exactly the same thing. That's why all means it's just all connected in a single stream. Means if you are not waking up far early in the morning, if you are sleeping in the afternoon time, and all these are just hampering your doshas, and your dosha will be vitiated, and it will just upside down your hormones, and PCOD will occur. That's the thing. And the junk
okay
food. Junk food I cannot miss. The junk food and the cold drinks, everything which is just hampering our digestion system. And it also
yes
hampering our blood, means just vitiating our blood. So our blood must be purified, our stomach must be clear to have a healthy lifestyle. Otherwise, PCOD like thing will occur.
ओके 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 सो पीसीओडी का एक कारण ये भी होता है हार्मोनल डिसबैलेंस तो
Hmm.
हार्मोनल डिसबैलेंस किस वजह से होता है
There are many causes of hormonal disbalance. Nowadays, I am getting maximum cause of hormonal disbalance is stress. Means maximum cause I'm getting is stress. Like
ओके
even I'm having stress, you're also having stress.
या
Starting from
people
you
start their
can't
day with stress nowadays
you
they
can't
just woke
find a
up
person
stressful
who is
यार मुझे
stress
ये
free.
करना है ये करना है ये करना है and they will sleep stressful there is no
Yeah,
peace
you can't find a single person in the world nowadays that who is stress free. We
yes
can't find a
exactly
single person. Either someone is having stress about uh, study study khatam, someone is having stress about getting a job, after that getting a job someone is having stress about getting the right salary, and
yeah
after getting salary they get the stress about uh,
married marriage
overspending of the salary, पैसा खत्म हो गया, अभी फिर से पैसा
ये
कम
तो
लेना है.
life ending cycle it never ends so
Yes, the
stress
cycle goes on.
yes stress is
The
the
cycle
reason
goes on. The
okay
space and the
and
thing, these are the one of the reason I am getting the main reason are these things. And another thing is staying up in the night, late night. That is also very much hampering our hormonal imbalance. Is that's the one of the problem reason for hormonal imbalance. And another thing again, another thing is our eating all those junk food, which is hampering our digestion system. These are all the things.
exactly ओके तो यहाँ पे हमारे पास एक क्वेश्चन आ रहा है इफ वी कंट्रोल पीसीओडी इज इट पॉसिबल टू कंट्रोल थायराइड
Hmm. Of course, and only in Ayurveda.
ओनली इन
Permanent cure.
आयुर्वेदा
Yeah,
ओके
only in Ayurveda, not in anything, okay? And
ओके
it's permanently cured.
परमानेंटली क्योर्ड ओके सो आयुर्वेदा से पीसीओडी परमानेंट ठीक हो सकता है
Absolutely. Absolutely. I have seen
ओके
cases, and I am also the one of the case of PCOD. Even I was having PCOD, and which I cured myself within 1 year. So PCOD can be cured within 1 year. It's not a big problem in Ayurveda doctors. It's not a big deal anymore.
even I am the one who was having PCOD previously but
Me
Ayurveda only
too.
cured me
Actually, main thing is it's very common nowadays, and one of the reason I told the stress and the thing, because means getting in the medical career, we have so much of stress of passing the exam, that thing, and staying up late. We have to stay up late for studies. All those things
yes
just made up of our hormonal imbalance, which just resulted in the PCOD. That's the thing.
ओके। तो अब ये चीजें तो हम चेंज नहीं कर सकते, स्ट्रेस वगैरह, तो हमें डेली लाइफ में किस तरीके का रूटीन फॉलो करना चाहिए कि हम इस चीज से बच सके इन फ्यूचर?
That is following Ayurvedic regimen, following Ayurvedic Ritucharya, Ayurvedic Dinacharya. That's the main thing. Nothing except this. Following a
ओके,
Ayurvedic
तो आप
Dinacharya
ये
is very, very hard. Very hard.
आप एक बार
But
ये डिस्क्राइब कर पाएंगे आयुर्वेदिक दिनचर्या में क्या क्या चीजें इंक्लूड होती है, क्या करना चाहिए?
hmm. So starting from morning, have to wake up at Brahmacharya, means
ब्रह्म मुहूर्त।
Brahma Muhurta, which is absolutely impossible for everyone, I think. Brahma
It's
Muhurta is
before, it's between 5 to 6, right? Brahma Muhurat is between 5
yeah,
to 6.
48 minutes before sunrise.
Okay.
I don't think anyone nowadays even sees a sunrise. So rising 48 minutes before sunrise, it's next to
That's
impossible.
really impossible nowadays, yes.
सनराइज देख ले वही अच्छा बात है बट बिफोर सनराइज waking up is a very big deal and after getting up okay woke up at 7 or 8 and after that going for a after that the dinacharya explained about दंत धावन के बाद उसके बाद है जीवन नीलेखन
Dant
जीवन
dhavan
नीलेखन
as in brushing your teeth?
या सॉरी
Okay. What is Dant dhavan? You अभी आपने कहा था?
Okay, sorry, I am just used the Sanskrit term. Then the dhavan is nothing, just the brushing of teeth.
Okay.
Just like we are brushing nowadays, so the same thing. But in Ayurvedic way, there are. It was told to use only kashai herbs. I think nowadays though no one uses neem sticks for brushing. Nowadays
हाँ.
everyone uses plastic brushes. So that's the thing. So after that, whatever you're brushing, after even there is a thing. Before brushing also, there are many person I know personally, they're having a bed tea.
Yes.
Without
I am one of
brushing, they're having a
them.
bed tea.
Yes.
Basically, that is also another thing for hampering our digestion system is waking up in the morning and having a bed tea, warm thing. In Ayurveda, it's told after Danta Dhavan, means after brushing, you have to do Jiva Nilekhan, that is cleaning of the tongue, and after that you can have Ushapan, that is water, which is not at all hot, that is a normal temperature water. And
Okay.
after waking up from sleep, without brushing, one is going for a warm tea.
Yes.
I mean, it's just we
Opposite.
three doors. It's just vitiating three doors से भी ऊपर कुछ होगा तो it's vitiating everything, vitiating. So it's
Okay.
like no, it's just hampering all the means दिन के शुरू में ही सब खत्म हो जा रहा है.
Okay.
That's
Okay.
it.
ओके। और फिर पानी पीने के बाद मतलब एज हमने पानी पी लिया उठने के बाद, उसके बाद मतलब पूरी, उसके बाद कब लंच, कब डिनर, टाइमिंग, स्लीप टाइमिंग क्या शेड्यूल रहेगा पूरा?
So I prefer means I ask my patient like who wakes up in 7 or 8 maximum of them. They have their breakfast. Some there are many who obeys me. There are many who don't obey me. But I have patient who have breakfast within 8 to 9, and I have patient also who have breakfast at 12 o'clock. Means
ओके।
uh, at the time of having lunch he is having breakfast. That's the
यस।
completely means uh,
रॉन्ग प्रैक्टिस।
wrong procedure. So that's the thing. But the right way, the right time of having breakfast is within 7 to 8. It's right time for having breakfast and not having paratha and all those bread. In breakfast, it is
ओके,
told to
लाइट
have a
फूड।
very light breakfast, very light breakfast. Like we can have some like what to say, juices, oats also we can have, but not those oily things. Okay, this
So
and brain
everything
is
is
also.
related to food. Everything is related to food. Means अगर हमारा food मतलब
Hmm.
लेने intake का timing सही है और हम सही चीज क्वांटिटी में सही चीज खा रहे हैं तो हम इस चीज से बच सकते हैं.
Absolutely, absolutely. Everything rises from our gut.
Okay.
So if we have a
और
healthy food, we have a healthy gut.
ओके ओके सो एवरीथिंग इज रिलेटेड टू गट. सो पीसीओडी में मेनली देखा जाता है कि फेशियल हेयर्स काफी आ जाते हैं, तो उनका कुछ क्योर है? मतलब क्या वो कम किए जा सकते हैं या फिर ऐसा हो कि ना आए? बिकॉज वो काफी वियर्ड लगते हैं. ग्रोथ, हेयर ग्रोथ, अनवांटेड हेयर ग्रोथ हर जगह, तो उसका कुछ.
Yeah, that's having a facial hair is very, very embarrassing for a female girl. So that occurs mainly because of high testosterone, which is present in our female body, which is in normal state. It just its normal function is maintaining of the body mass, the bone density, the memory, and also controlling the menstrual cycle in normal stage when it's in normal. But when it's getting high, it what it is causing is facial hair. And another thing that occurs in PCOD is hair fall, too much hair fall. The male pattern hair fall is there, means baldness at the front side, yeah, that center pattern, that type of baldness is seen in PCOD, and that is occurring because of testosterone. So we have to control this hormone testosterone, like the same thing I told before, that hormonal imbalance, we have to control it by maintaining a healthy lifestyle. But nowadays I have seen that having a facial hair, once you have a facial hair, then many goes for a upper lip. That's the thing.
Yeah,
But
that's a necessity nowadays.
many goes for that thing. But after you get facial hair, you have to look after that. You follow the healthy lifestyle. But there is no way, that means I saw many social media influencers that ये खा लो, ये कर लो, your facial hair will be gone within
ये
one day,
लगा लो.
within
Yes.
1 week. No, no, that's completely wrong thing. Just nothing happens like that. Once you get facial hair, there is no way you have to do. For the girls, they have to go for a upper lip. That's the only thing. There's no thing. But you can control the thing by just following the Ayurvedic regimen. And once your hormones are in balance, back to the balance, your facial hair will automatically stop growing. That's the thing.
सो कहीं ना कहीं क्या पंचकर्मा इफेक्टिव है इस डिजीज के लिए?
Of course, why not? Means starting from in PCOD, one of the main thing happens for the because of the hormonal imbalance, there is a lots of mood swings. For
Yes.
to control these mood swings, we have to do like there are many panchakarmas which can help in mood swings. After that, in PCOD, we can do is there are constipation problem also in PCOD, because as I told that they don't follow the PCOD affair, the means affected girls, they don't follow root Ayurvedic way, means Ayurvedic regimen. Their digestion system is not good, so I go for a Virachan. Virachan can absolutely help help in PCOD to clear the gut and have a healthy digestion system. Once your digestion is healthy, you just have a healthy lifestyle. In Panchakarma, like Shiradhara, Virachan, Uttar Basti, everything helps.
ओके. सो ऐसा भी सुनने में आता है कि पीसीओडी की वजह से रेगुलर पीरियड्स रहते हैं तो फिर बाद में कंसीव करने में भी काफी प्रॉब्लम आती है, तो क्या ये सही सही चीज है कि
See,
आजकल ये बहुत नॉर्मल हो गया है कि अगर इंसान
yeah.
को अगर कंसीव करना है तो वो पहले डॉक्टर के अपॉइंटमेंट लेता है कि क्या डेट्स है क्या है, तो मतलब ये काफी नॉर्मल हो चुका है आजकल. तो मतलब
Yeah.
क्या उनको उसी की वजह से प्रॉब्लम होती है, पीसीओडी की वजह से? इसका
See,
क्या
there are many
सॉल्यूशन
causes
है?
of infertility. There are many causes
या
of infertility. But
यस,
PCOD, having a PCOD and conceiving is absolutely, PCOD is one of the cause for means not infertility. If you are having a PCOD, you of course will not be infertile. That's a very misconception. Once you control your ovary, once your ovary is free from the cyst, you will of course automatically conceive. And there are also some of the means there are many cases like with PCOD the woman conceived. So there is no link with this. But yes, there is difficult to conceive in PCOD, but it's not impossible to conceive in PCOD. If you are having PCOD and if it's not treated in the right time, if you are running behind those birth pills, then of course there are no way of conceiving. There are no way means you are not having any more options
तो क्या
to other
मतलब
than
बर्थ पेल्स अफेक्ट करती है, मतलब पीसीओडी, मतलब बर्थ पिल का कुछ कनेक्शन है पीसीओडी से? मतलब अगर जो इंसान बर्थ पिल्स ले रहा है, क्या उसको
yeah.
पीसीओडी होगा फ्यूचर में जाके? ऐसा कुछ कनेक्शन है इन दोनों के बीच में?
See, in Ayurveda, I get maximum patients of PCOD who had birth pills at first, who didn't have period for 1 year. I got patient who didn't have period for 1 year, and
ओ माय
also got patient who didn't have got get period for 1 month, 2 months, like this. The thing. They firstly opted for a birth pill, the easiest way of getting a period, easiest way. But that's not the process. How many birth pills will you have? Means whenever you are not getting period, you will just pop up the pill. That's not the process. That's not what the side effects of birth pill. That is a hidden thing. Means no, except the doctors, no one. But I don't think nowadays no one is unaware of the side effects of birth pills. That's why
इट्स
more of
रिटन ऑन द
patients are.
बॉक्स ओनली। बर्थ पिल वाले बॉक्स पे लिखा होता है उसके साइड इफेक्ट्स, फिर भी लोग ले लेते हैं।
There are many side effects of birth pills, and for these birth pills only, they are very difficult to conceive. Only for these birth pills only. Otherwise, in PCOD, it's not at all means impossible to conceive. But for these birth pills only, the whole system gets so much complicated that the female body gets more complications to conceive.
एग्जैक्टली,
And
वो
other
इट
than
डिपेंड्स।
Ayurveda, other
या प्लीज।
other than Ayurveda, the other paths just gives the option for treating PCOD is birth pill. But in Ayurveda,
Yes,
we don't also want
in
birth pill.
allopathy, all they give is the medicine you have to eat for 5 days, and after that you will get your periods. And when you get your periods, after
Hmm.
1 week, you have to come and take a medicine for 21 days, and your periods will be regular. But what happens is
So,
your body get dependent on the pills, and you will not get your periods for next 3 months.
hmm.
It, and the cycle continues. Yes,
Yeah.
I faced this issue before.
This is the scenario of the PCOD girls who have means pops the pills or birth pills. Is every time they goes to the doctor will tell there are two options. They will give you two options: either to marry, will tell you get married,
Yes,
or they
exactly.
will
This
give you.
happened with me. When I went to the doctor to ask that my periods are not regular, and he was like, "You should marry early and have kids." And I was
Yeah.
like, "Seriously? How can you say that to me? I am only 24 and you are asking me to get married just because I am not getting my periods. This is a stupidity." Then I opted for Ayurvedic Raj, and now I am absolutely fine.
Yeah.
Exactly.
Ayurveda,
I
of
understand.
course, works amazing in PCOD. Of course, works amazing. Means there are
Yes.
many cases now. Nowadays, every person now are aware of the PCOD and Ayurveda thing. Means everyone now before I used to get patient who used to pop up pills and comes. Then after that, घूम कर फिर Ayurveda के पास आते थे. And now I get patient who directly comes to Ayurveda for PCOD treatment. who did
Exactly.
not even have popped up this birth pills. Before there was
Okay.
some unawareness like this, but once a patient gets cured, the patient always means बोलते रहता है कि मैं क्योर हो गया
Exactly.
वैसा.
They're surprised. कि wow, permanent illness.
Hmm.
Exactly. Okay, so coming to the last question, तो आप PCOD की कुछ home remedies share करना चाहेंगे मतलब जो इंसान घर पे ही कर सके?
There are no PCOD home remedies. Like no home remedies in PCOD. What home remedies in PCOD? Like do yogas, have follow the
Okay.
Ayurvedic regimens, and all these things. There are no like no home remedies type things in PCOD.
जैसे you have to go to doctor only.
Yeah, directly visit the doctor, do yogas, follow a healthy Ayurvedic regimen. If you are facing any problem, directly visit to the doctor. The doctor will, of course, understand your individual problem because in Ayurveda, like we doctors feel that everyone is different. So
Yes.
if I am giving a home remedy here, the home remedy which will act on you, it's not at all the thing to be acting on
Applicable
another
on
girl,
someone else.
applicable
Yes,
on
yes.
another girl. It's not at all the same thing. So no home
Yes.
remedies. Like visit the doctor if you are feeling any difficulties, if you are having irregular menstruation, if you are having obesity problem, mood swings, if you are seeing any any difference in your facial hair, if you are having excess hair fall, all and insomnia also not getting to sleep early not any facing any digestive system problem, visit to the doctor will understand what you're going through exactly.
Okay. So let me ask audience अगर किसी के पास अगर कुछ क्वेश्चन है तो वो पोस्ट कर सकते हैं.
Hmm.
हमारे पास यहीं पे डॉक्टर अवेलेबल है अभी. Okay, so I have a personal question. Is white discharge is somewhere related to PCOD?
Sometimes white discharge sometimes occurs due to hormonal imbalance, so it
Okay,
can be that way connected with PCOD.
okay, okay.
Oh,
So we
there is
are
a
getting
question
to
like how much minimum time it take to correct digestive system. It depends on you. How much means how your body will act and how much obedient will you be to follow the regimen.
okay,
It depends on you. Absolutely depends on the person to person. Depends. It don't means it's not at all a common thing. The time I will take to cure my digestion, it's not at all the same thing will happen on another person. So it varies from
okay.
person to person.
Okay, so I guess there are no questions. Here is one question. How much minimum time it take to correct digestive system?
Yeah, that's the thing I just answered now.
Yeah, okay. Okay, so we don't have any questions. Thank you so much for joining us today. It was a nice
Yeah.
session and it's nice talking you. I hope
Thank you so
हम
much
आगे भी
for
ऐसे.
inviting me.
Okay, thank you.
Thank you.
Uh, you can okay, okay guys, so do follow Ayurlekha. Thank you so much for joining us today, and I hope all your queries are answered. Don't forget to follow Ayurlekha and follow us for more live sessions. Thank you so much. Have a great night.